Why do so many of us in the jaw hacking space, including myself, have such chronic, terrible neck pain and headaches? And what can we do about it? The answer to the first question is that neck pain results from poor neck posture, and poor neck posture results from small jaws and a small airway. Poor neck posture is a maladaptation to open a small airway. In other words, when our jaws are small and our throat is a tight tube instead of a big wide tube, the way we open our tube is by going like this. Because when we jut our chin forward into a nerd neck posture, it opens our airway in spite of our small jaws. The only problem is that this wreaks havoc on the back of the neck. It wreaks havoc on our upper spine. It wreaks havoc on the peripheral nerves in the occipital part of our scalp and head and neck. And that leads to a condition called occipital neuralgia, in which nerve pain from the back of the neck radiates forward into the temples, into the forehead, into the eyes, and into an all-out headache episode that people sometimes confuse as a migraine, although truly when it comes to headaches, a rose by any other name smells as sweet, or a fucking turd by any other name smells as terrible. All headaches, regardless of whether we call them migraines, tension headaches, occipital neuralgia, you name it. I believe that it doesn't really matter what we call them. Most headaches have a huge component of mechanical compression of nerves in the neck that results from small jaws and poor neck posture. And when we have this poor neck posture all the time, as we drive around and as we sit at our desks and as we play sports and so on and so forth, we're causing micro trauma to the greater occipital nerve, the lesser occipital nerve, and the third occipital nerves. And hence we have neck pain and headaches. Also, when we have a weird neck posture, we cause nerves emerging from the spine to get pinched. And this can lead to different types of neck pain that tend to radiate down into the arms or into the back instead of up into the head as headaches. Most people that I talk to have junked up necks that experience the type of pain that I'm describing, whether it be headaches or whether it be other types of burdensome neck pain. What can we do about it? Well, first we have to accept that for most of us, because we're never going to have perfect jaws, we're never going to have perfect neck posture. And because we'll never be able to perfect our perfect neck posture, we're going to have to accept that neck pain is something we'll be managing for our whole lives. So it's not really a question of curing, it's a question of managing and minimizing. Now we can put a large dent into our neck pain by expanding our jaws, giving ourselves a bigger airway, and reducing our need to maladapt our neck into a poor neck posture just so that we can breathe. MSE and expanding the maxilla, getting the tongue up and forward out of the throat, improving your nasal breathing, helps with your ability to maintain a slightly better neck posture, a more elongated upright neck posture as opposed to a nerd neck posture. This helps, okay? A double jaw surgery could probably have a dramatic impact on neck posture as you take that whole maxilla and you counterclockwise rotate it, giving yourself the ability to have an elongated neck posture like this without your jaws slanting down toward the earth. Because most people with underdeveloped maxillas, their maxilla is not only recessed, it's also down swung. And so the counterclockwise rotation in the forward advancement helps you have a better neck posture while still also being able to breathe. So in general, expansion is going to help, but even if we expand, it's not going to be enough, because chances are by the time you're expanding, you're already 20, 30, 40, or 50 years old, perhaps older. I've talked to people that have gone into MSc in their 50s, 60s, and beyond. And you've accumulated decades of microtrauma around your structures in your neck, your peripheral nerves and your spine, in your musculature. Some muscles have atrophied, some are too tight and tense from being overused. So after we expand and we improve our neck posture, we have to hit the reset button on our neck. And we do that in a few different ways. The first thing that I did was I had peripheral nerve surgery or migraine surgery with Dr. Zeev Peled. And I did a JawCast interview with him back in December. Check it out. Dr. Peled found that when he went into my neck and looked at my occipital nerves, they were cloaked in scar tissue. This white, tough scar tissue that was impinging on the nerves constantly. Even if I had improved neck posture, that scar tissue would still be there. So you have to get yourself back to a blank slate by clearing off the scar tissue from nerves in some cases, or at least that was true for me. Do you need to do that? Not sure, but it's something to keep in mind. The other thing that we can do to help with our neck pain is to train the neck. And this really is the nugget that I want you to take from this video. You can have imperfect jaws and have a junked up neck, but if you train that puppy, it's gonna have resiliency. I believe that God created the human body to have a tremendous amount of pain resiliency and injury resiliency through exercise. 20 minutes of cardio a day flushes the body with happy chemicals and natural pain-killing chemicals and can help you overcome structural imperfections in your neck. I jog every morning, let's say 6 days a week, 2 miles. It takes me about 20 minutes. I go up the road and back, the same route every day. And that sets a foundation of endorphins and pain-killing chemicals that percolate throughout my body all day and help numb what otherwise would be a constantly aching neck. Also, strengthening the upper body, and really the whole body, because the whole body is interconnected. But pull-ups, dips, push-ups, and pike push-ups into a sort of neck bridge. Not really a neck bridge, but just resting on your head with your legs on the ground, sort of a headstand, and just putting a little bit of pressure on the neck to help train it and strengthen the muscles around the neck. This can also provide a huge amount of relief and endurance and strength into a neck that's otherwise bumming. So don't shy away from your neck pain and your injured neck and your weak neck. Train it. Exercise. And strength training for that part of your body will help you cope and manage your neck pain throughout your whole life. And it's not something that's ever going to go away, most likely. And I know that's true for me. I've come to terms with the fact that neck pain is something I will manage, not cure. But that's okay, because it encourages me to take care of the rest of my body too, with fitness and with general health. So that's it for this video. Let me know your experience with your neck pain and whether or not you think there's a relationship between neck pain and small jaws in the comment section below. Thanks for tuning in. Check y'all soon. Peace out.